Doctor, it's been more than a month since the world was surprised with this COVID-19. Tell us about it now. After more than a month, have we gotten our legs with this virus? Do we know how to deal with it already?
Thank you for having me here. And now, as we call it, COVID-19, right, or coronavirus disease 19, is a new problem the world is dealing with. The first indications of this outbreak came on the 30th of December when the authorities in Wuhan, in the province of Hubei, detected a pneumonia of unknown etiology. Since that time to date, we've gone a long way. We've isolated the pathogen and identified it as a coronavirus, the novel coronavirus 2019. We've learned some things about the disease it causes, how it spread. We are understanding how to manage those patients better. So we are working as a global community to rise up to the challenge that this disease is posing, both to China and to 24 other countries at this point of time, but potentially to the whole world. As our Director General, Dr. Tedros, last night said, the world is faced with a very grave situation, and it calls for a coordinated international response. And that's precisely why he convened the Emergency Committee of the International Health Regulations, which after 2 rounds on the 22nd and 23rd, and finally on a 3rd round on the 30th of January, decided to classify this event as a public health emergency of international concern.
Yes, doctor. Well, doctor, if you look at the rise in the speed of the infection, the spread of the infection, it seems to have relatively plateaued compared to the middle of January. The last I checked the graph, it was like that.
Yeah.
Now it's a bit not as steep anymore. So are we learning to deal with this in terms of stopping or containing the infection?
Yeah, so we are encouraged by the results coming out over the last few days. It's clear that still the overwhelming number of cases are coming out from Wuhan city and Hubei province. But if you look closely at the data coming out, you see that on a day-to-day, the number of cases being reported globally and in China is now on the downward trend. So we hit a high of about a few hundred, over 3,000, about 3 or 4 days ago. And now you see that we are at about 2,100 a day. So this is good.
A deceleration.
Deceleration. And it shows that the containment efforts being implemented inside of China and certainly in other countries are contributing to controlling the spread of this disease. We see 24 countries reporting cases, but the vast majority of those are cases that of people who traveled out of China.
Yep.
We see in a few countries local transmission. So we have clusters of local transmission in a few countries, which is worrying, which is also why WHO classified this as an international public health event. So the trend now seems to be that the measures being implemented by China are bringing to bear fruit on the number of cases being reported reducing. On the deaths, I believe yesterday or day before we had the highest number of deaths when we exceeded more than 100 deaths in one 24-hour cycle. Today it's marginal, but it's still less than 100, it's 96.
Yeah.
So we are hoping that we've reached that plateau. The control measures being implemented are having their desired impact.
Yep.
And maybe we've started seeing a decline in the numbers.
Yeah. Now,
We want to be optimistic.